Welcome back. As promised, let's bring you a health check now using graphs of the latest COVID-19 stats. Restrictions have been lifted as infections have come down dramatically. In fact, the infection rate is less than a quarter of what it was at some point in December when the second wave was moving across South Africa. Let's find out exactly where we are. We're joined by the CSIR Senior Researcher, Dr Ridhwaan Suliman. Doctor, thank you for being with us as always. Let's start with the average daily cases per week, the graph you've provided, and the downward trend continues.
Good evening, Francis. Indeed, the downward trend does continue, and it is looking quite promising across all indicators, in fact. If we start looking at the daily cases first, over the last week, the average number of new cases reported in South Africa now stands at 3,500 per day. That's a decrease by 45% compared to a week ago. As you can see by the height of the bars, that continued decrease is quite promising. As always, we do know that the number of cases is influenced by the number of tests that we conduct, simply because we don't test enough. But the decline in the test positivity measure, or the proportion of tests that are returning positive results, confirms that the decline in infections that we're seeing is real.
All right, and we'll go into more detail around that test positivity rate. But first, if we bring up all the provinces, are we all out of the woods, as it were?
Well, I wouldn't say we're out of the woods, but the downward trend is promising across all the provinces. If we look nationally, the number of new cases have halved over the last 8 days. If we break it down in terms of the provinces, KwaZulu-Natal, Eastern Cape, Mpumalanga, Limpopo, and Free State have all decreased by 50%, meaning new cases in those provinces have all halved over the last week. That being said, the incidence rate in these provinces is still, well, not relatively high, but is still at levels that aren't quite out of the woods just yet. We need to maintain this momentum and continue to decrease the transmission to much more lower and more manageable levels. If we look at other provinces in Gauteng and in Western Cape, the rate of decrease has slightly slowed, 35% decrease compared to a week ago, but that decline continues, and the test positivity in those provinces and across all the provinces is decreasing. So certainly promising signs.
So let's bring up a graph around testing now. We know, like you said, when there's less demand, the tests come down, obviously. But is the testing active enough at the moment, Doctor?
No, I don't think it is active enough. As you indicated, the number of tests are decreasing. And although it sounds counterintuitive, it's a reflection of the tapering wave that we see in the infections, in the curve of infections. At the moment, over the last week, the average number of tests is down to 32,000 per day. And that, as you can see, has continued to decrease over the last 3 weeks, a decrease of 25% compared to a week ago. I do think as we ease restrictions, we need to, in fact, be more vigilant and maintain or even increase the amount of testing that we do, as this remains an important tool that we can use to be proactive and get ahead of the curve to combat this virus. We can indeed do this by incorporating additional antigen-based rapid diagnostic tests, in addition to the PCR test that we currently use. I think there's certainly scope for more of these rapid tests to be incorporated across the country. It can be used proactively to backtrace and identify super spreader events or cluster outbreaks, and to prevent a resurgence. I think beyond that, we can also incorporate randomized and even mass testing, possibly even rolling out mass testing to workplaces homes, schools, so that we can pick up any resurgence and certainly get ahead of the curve. That being said, that testing needs to go hand in hand with the isolation of positive cases, as well as the efficient tracking and tracing of contacts of positive cases.
Very quickly, while we are on this, you see it advertised, the antigen test, the rapid test. How do people decide what test to go for?
I think at the moment it is quite confusing. The gold standard remains the PCR test, and that is the one that certainly confirms the positive infection. And generally when people go for testing, specifically in the private setting, it's the PCR tests that are being used. I do believe that then the scope where we go out in communities conducting randomized and mass testing, that we can proactively incorporate these antigen tests. At the moment, although we don't quite have the figures of the proportion of the different tests, maybe as an indication, over the last week of January, the proportion of tests that were antigen-based as compared to the PCR test was 16.6%. So I believe when people go out for testing, it's the PCR tests that are still being used.
All right, very quickly, let's look at the positivity rates. These were very high at one point, and you've pointed out if so many people test positive when they go for testing, it means there's a huge prevalence in the rest of the population, and we're just not catching everybody. Are we getting a much better picture right now? What does this mean?
Indeed, we certainly are getting a much better picture. Remember that the test positivity is a function of the cases as well as the number of tests that are conducted. It's a proportion of positive tests in relation to total tests conducted. So while the total number of tests have decreased over the last 2 to 3 weeks, the number of those tests that are returning positive results has decreased even further. And so the test positivity measure has actually continued to decline. Currently, we're sitting at around 11% test positivity in South Africa, meaning that 1 in every 9 tests are returning a positive result. Compare that to 4 weeks ago, where the test positivity was above 33%, meaning 1 in every 3 tests that back then was returning a positive result. So certainly a much better situation right now, and a reflection that the decrease in the cases or infections that we are seeing is real.
All right, and thankfully, I mean, hospitals around the country are reporting much less pressure on their facilities, and that's borne out in the numbers, right?
Yes, absolutely. We always talk about this lag between cases and hospitalizations and then in deaths. What we're seeing is that the hospitalization curve is certainly following the cases trend. Over the last week, the new admissions across South Africa has been just below 6,000. That's a decrease of 43% compared to the prior week. And this is reflected in all 9 provinces. All of them have decreased by between 35 to 50%. So certainly a lower pressure on the hospitals and healthcare workers right now.
Very good news. We do have to look at the grimmer stats. There's a lagging effect as well when it comes to deaths. Let's look first at the national death rate. What are the numbers telling us?
Well, actually, this is probably the most promising curve, although it is grim to talk about deaths. If we look at the decrease that we're seeing reported this week as compared to previous week, there's a 34% decrease this past week, and that again has followed the trend that we saw in cases, it's following the trend quite nicely. At the moment, the number of deaths across the country, the 7-day average is 318 per day, while of course that is high, and every death is a death too much. The promising trend is that across the country, the number of deaths reported is on the decline.
If we bring up the provinces, though, there are some anomalies. The death rate is still going up in Limpopo and the Free State.
Well, if we look at across the provinces, bear in mind that this graph is the number of deaths by reporting date. The erratic nature that we see between the different provinces is generally due to the reporting and the timing of the reporting. Across all the provinces, indeed, we are also now seeing a decline in the number of reported deaths. The spike that you see in Limpopo is due to a backlog or auditing of deaths that happened between September and January. So some backlog of deaths, which causes a bit of a spike there. Generally, the trend is downwards, and if you can compare the reported deaths with another measure, that being the excess deaths, it does confirm that generally across the country and across the provinces, the number of deaths is promisingly on the decline.
All right, so overall, this is promising. This is a good picture. But there is talk of a third wave, Doctor. You've pointed out how behavior seems to be so important in these stats. What do you think could happen now that we're opening up?
Well, that is the important question. The risk of further outbreaks and cluster outbreaks, even super spreading events, always remains. I think that's why we do need to remain cautious and even vigilant. One of the proactive tools, as I talked about earlier, is to increase testing and to monitor any resurgence and to bust these clusters, in fact, before they actually happen. We also need to, as we ease restrictions, ensure that we limit gatherings, particularly people that are in close contact and in indoor settings where ventilation may not necessarily be as good as outdoor settings. This remains an important factor as we go forward. As we monitor the further movement of people and the easing of restrictions, the risk remains, but there's certainly tools that we have that we can monitor so that it does not necessarily become third waves or even subsequent waves thereafter.
Yeah, that would be great to avoid that. Indeed. Thank you very much, CSIR Senior Researcher Dr. Ridhwaan Suliman. Let's